Hello everyone, and welcome to this special learning session on FHIR. So you've been asking what is FHIR. FHIR means Fast Healthcare Interoperability Resource. That is what FHIR stands for. So I'm Olumide Oduola from Softlyft Technologies, and I'll be the host for the session that we'll be having today. It's really great to have everyone here, developers, tech enthusiasts, software testers, project managers, and people that just want to know more about FHIR. It's really great having everyone here. We all know how tech is changing the landscape, and that is why we need to actually discuss this topic at this point in time. So at Softlyft, we've always believed that knowledge sharing is one of the most important, most powerful ways to actually grow and build communities. We are big on building communities. So this session is part of our own way of actually bridging that gap, ensuring that there's collaboration. People know more about the real world application of FHIR in healthcare, and also learn more about what is going on even in our Nigeria landscape here. So today we'll be talking about FHIR, as we all know, what it is, how it matters, how it affects our healthcare, how it affects you as a person. We'll be discussing that. And I'll be introducing our facilitator for today. Olumide Oduola is a software, AI, and FHIR engineer with several years of experience on FHIR. And we are going to be having a session for Q&A at the end of this session. So if you have any question, just note it down. You can drop it in this chat. We'll definitely get to them. So I'll be handing over to Olumide now, so we can get started with the session. Olumide, over to you.
Thank you very much, Bumi. I believe everyone can hear me loud and clear. Okay, great. My name is Olumide, as she has introduced, and I'm a FHIR engineer, also a software and AI engineer. So I've been working with FHIR since 2018, and I've built solutions on top of FHIR. So this session, it's gonna be, dead simple, since it's an introductory class to FHIR, and it's gonna help, beginners, health professionals, developers, just understand what FHIR is and its application. The challenges most people have been having is, okay, even people that have been working with FHIR, they don't understand how it's applied technically. Unfortunately, I have built solutions on top of FHIR, and I hope this introduction is going to help us, have an understanding, those that have been working with it initially, to have better understanding on how they can apply it, and those that have no knowledge at all can, understand and see the importance of this to our society. Okay, so I'm going to go through my agenda for the day. It's going to be pretty short. So we will be discussing what FHIR is, why FHIR matters, and thirdly, we'll be talking about the FHIR core concepts. I will be talking about the resource models, discuss FHIR APIs interaction, implementation tools and ecosystem, and we're going to have a very short demo, which is going to be in two parts. We're going to have a FHIR server walkthrough, which is going to be an open source FHIR server. We're going to be using Happy, and an application walkthrough. How does an application interact with FHIR? Then we're going to take questions, a few questions, and just to wrap up the session. Like I said, those things I'm not going to discuss in this session. I'm not going to discuss the history, how it all started. You can take some time to just read that online. So let's get started for the sake of time. So we're moving to the first one. What is FHIR? It's spelled FHIR. It's pronounced FHIR, and it's just Fast Healthcare Interoperability Resources. And it's a standard developed by a company called HL7, which they actually cater for healthcare data to enable modern web-based data exchange. Healthcare data, to be specific. And here I've listed the goals, the technologies FHIR is built on, and how you can interact with it. and the use case. Now, it's to simplify interoperability between healthcare system, which simply means, exchange of data digitally. So a simple use case is when you visit an hospital and in a particular location, they take your vitals, they record your encounter, several things, and something moved you away from that environment, and you move to a different state. Naturally, when you visit a different hospital there, or your community health center, whatever, there should be a record of your healthcare traveling with you. And we discovered that it's a big problem, right? Your healthcare data does not travel with you, one. So the practitioner you meet there, the doctor, the nurses, or the clinician, they just gonna, start all over. They start asking questions. Let's say that's the first problem. Now, the second problem is, let's say the previous hospital is even, digital, and the new clinic or hospital or health center, wherever, needs to, request for your healthcare data from this previous one. Okay, we need to see your healthcare record. Okay, you can get it online. We discovered that the format which this previous hospital saved their data is totally different from the formats of, the new hospital. Probably they are using different EHR system. It becomes a problem, and meaning the mapping becomes a bit technical, and you can see that the EHR they're using does not have a direct mapping to the new hospital you're using. So most hospitals now, they don't even exchange data. They keep their data, then you move on to the next one, you start all over, right? Which is a big problem. And that's the problem, the exact problem FHIR is trying to solve. It means when I'm designing my system or the EHR, EMRs I decide to use, if it's FHIR-based, meaning even if you move to a different clinic and they need to transfer the data, it's the same mapping we're using. So what FHIR simply define is, okay, if you're gonna keep a patient record in your system, this is the format you should follow. If you're gonna take my vitals, this is the format you should follow, right? And like you can see that the key idea is to bring healthcare data out of the legacy systems and make them accessible across so we can connect. Whether I'm connecting from my mobile device, you're using an IoT device, probably you're running and your device is actually reading your vitals while you're jogging or exercising, whatever sport you're into. The data is streamed directly to the exchange. We're certain the data can be stored in a format where if I am or someone else is building, an analytic solution, I can pull the record and I know the exact format to follow. So that's what it fixes. I hope that is clear. So why it matters because I think I already mentioned some of it. Interoperability, which is the core concept. It's actually connected EMRs, HRs, labs, pharmacies, mobile apps, whatsoever. Any player in the healthcare system, it connects them together. And it gives speed. Web 2, the age of Web 2, there's speed in terms of internet. So compared to the previous versions, before FHIR, there are previous versions. You can go and study the history of FHIR, how the maturity level and how it's evolved. Before FHIR, we have some other versions. So this is easier to implement in terms of speed compared to the previous versions, which are version 2 or CDA standards. It's very flexible because it has a modular structure using resources which was carefully defined. And we're going to get to those parts and you're going to understand what we're talking about later. Adoption. Yeah, it's been adopted by major vendors. Sena Epic, these at least if you're not familiar with Sena Epic, some of us have worked with them. We're familiar with Apple Health and Google Cloud. Like I said, Apple Health, your device can record the healthcare system, your healthcare data, and it can be saved in such a way that every other parties connected to it or devices can actually pull data in the expected format. Then policies, The policies governing, it's mandated by ONC. ONC is just an organization that manages data in the state. It's they actually in charge of digital health. So they actually mandate this for use. Um, so while we have some of this connecting to, it's important we know this adoption and NC, and we're not definitely in the States, but this is a global, initiative. So you're going to understand why we're using some of these references as we move on. So also we have some other health initiatives like DHIS. There are platforms you can use for open EMRs, open IHE. There are a lot of EMRs that are open source which you can take and build on. Then we have some FHIR smart guidelines, which that's the World Health Organization. They're big on this as well. They've created a guideline on implementation. Okay, moving on to the third slide, the concept of fire. These are very important. These are the things you're going to come across every time you hear the word fire, you interact with it. Right? Resource, this is the building block, the basic building block of fire. And each represents a type in healthcare data. For instance, patient is a resource. It defines the type of anything related to me. For instance, I'm a patient. I visit the hospital. They take some things from me. The things the first time visit, my name, my age, my next of kin, things tied to me. That's a patient resource. It can be defined. For instance, if you took your child for immunization, to collect vaccines and all, there's an immunization resource which will be defined to record the type of vaccine, the dates, and some things regarding the vaccines. I'm still going to show you this, on the website. We have the profile. This is like a custom version of the resource. We have the terminologies in terms of the use of code. We have some type of core ICDs, NOMAD, and the rest. Meaning for instance, speaking of vaccines, for instance, if you take BCG, right, there is a standard code that we can use to identify the BCG, right, which has to be unified. Snowmed had this code defined and some other, these code maintainers, and they have a way of actually defining it. Meaning, for instance, paracetamol, if we need to record paracetamol for a patient, I want to be sure everyone is recording it as, let's say, PCM, for instance, right? So if I want to implement paracetamol, I know, okay, the code is PCM. So that if someone else is implementing it, you won't go and write the full name paracetamol, then we have a conflict because the system is okay, paracetamol, PCM, I don't understand, right? But once we have a code which is standardized, my system can support ICD-10. So anybody integrating with me, okay, I support ICD-10, 11, or whatever. Okay, SNOMED as well, I support it, and so on. That's the code and technology. Yeah, it goes beyond that, but I just use that to create an idea. We have references. These are links from resources to other resources. It's like a mapping, meaning if you have a patient resource, it can map to an organization, meaning it can map to a practitioner. Like, okay, this is the practitioner that is tied to me. Maybe is my something in our time we can call a family doctor. If you have a family doctor that the hospital has assigned to you, then under that it can be linked as your practitioner. Then you can see the results of your practitioner right there. So all those references, immunization can be linked to a patient, definitely. It can be linked to encounters and the rest. So bundle is just a collection of resources sent together. At times you want to perform some bulk transactions, you just gather all these resources you need to store in your FHIR server, and you create a bundle out of it that you can send it once as a message or probably transactions. So the implementation guide. The implementation guide is a document structure to know to help you understand how how you can use FHIR in your context. For instance, if you look at the way data have been collected across the globe, the way the healthcare system works in the States is different from the way it works in Nigeria, right? It's different from the way it works in some country in Europe. I don't know if Europe is unified, but I know there are some country-specific, implementation guide across the globe. So meaning we as a country, we have the base resource which FHIR has defined. Okay, this is how this thing must be structured. But out of that, we can take our implementation guide. Okay, for our use case, for instance, patient. Let's take patient for instance. Tribe is a big deal in Nigeria. And probably when we take the patient resource and we are defining our implementation guide, this is just an instance. So you could say, okay, you could include tribe in the implementation guide, right? But then it's specific to us. Probably if you go to the state and look at the implementation guide, they don't care about it, right? Yeah, everybody's American, right? Or you go to the UK, everybody's British. I don't know. But here, probably we care about it, even though it's not a big deal, right? We don't really care about it. It's not important to the healthcare record. But as instance, so meaning I can customize the base FHIR resource and create an implementation guide for my country out of it, which targets specific things. We're still building it on top of the main block, which is the standard that's been defined, but we can extend it and create an implementation guide out of it. So if I'm building a solution for Nigeria, I won't be looking at US implementation guide. I look at the standard, so far it conforms with the implementation guide, then I use the implementation guide to build. For instance, NIN, right? That's US Social Security, we use NIN. Then when I'm looking at it, okay, the identifier for this patient is NIN, right? I put it there. So anyone trying to connect to my server or my system, which is FHIR-based, and they're trying to pull my record, they know NIN is the primary identifier for Nigeria. I hope that's clear. So we adopt this across multiple resources. Moving on, so we're going to look at the resource models. We have a lot of resources, about 150 plus. I don't know the exact number, but you can always check. And definitely it's huge, so you can use everything. Depending on your use case, that's what you're going to care about. So we look at the categories. We have the patient administrator, which has to do with like the patient, the practitioner, the organization. The clinical, that's the encounter observation conditions, things you do when you go to the clinic. Diagnosis, people in imaging, diagnostic reports. If you've done something around DICOM, that's image streaming. Yeah, you will worry about this. Financial, yeah, explanation of benefit claims, coverage. This is people using HMOs. For instance, they come to the clinic, they've been attended to, then the HMO needs to pay. Then this is where there's a claim that is filed. This is where it's been recorded. Okay. And explanation of benefits just shows more of the cost implication of the services that's been rendered. We have the coverage, the invoice. You can record all those things there within the system. Then we have the workflow questionnaires. You need to send out questionnaires. There's a clear plan and all those things. You can throw it out there. These are just some of it. And structure of the resources, the metadata, it has an ID, the metadata layers updated. These are just a few, which I'm going to show you some of it. Then the core element, which is defined on the FHIR specs. And we have the extensions. The extension is things that are not standard. They are things that it can't just fit in, even after the standard has been created and you've had your own IG, there are still some things that just don't fit into any of those standards. And there's a place you have to put them, and they're important to us. Right. So that is where you start thinking of the extension. Now, this is a bit techy, but everyone should understand it. These are basic CRUD operations and some little extra on how we interact with the FHIR server. Just think of FHIR as this, it exposes an API, REST API by standard. This repository of data, it's in basic terms. This repository of data that you can just structure, it defines the structure to like, okay, this is the way I want my data, and this is the way you must interact with me across. So if you're gonna query me, I don't care who has built it, this must the pattern you must follow, right? So we have the gets, which when we're trying to read data, you can make a get request. You can define, as an example, define the patient, the resource name, and the ID of the patient. You can do a post to create data, you can do an update, you can do a delete to remove the data, you can do a search to search, okay, you're targeting, okay, I need this type of observation for this patient, where the type is. Blood pressure. These are just a few. Now the formats, you can get your data back in JSON, you can get back in XML, or I think there are some other formats, yeah. And for the authentication, there are actually standard ones which engineers are familiar with. So if you're gonna implement, you're gonna stick to or Smart on Fire implementation. So we're not gonna be discussing Smart on Fire here. It's, you can just go and read up on it if it's important to, or, if you're an engineer or you want to perform some kind of OAuth on top of Fire server. Okay, now let's quickly talk about the implementation tools and ecosystem. It's quite big, but there are some common ones which are very popular. API Fire server, you can just go there. I'm going to be using API for the demo. It's an open source Fire server which you can just host on your own. It has some cool features. They have an open a deployed version as well, which we're going to interact with right now. And we have some Firely server. Google has Google Cloud Healthcare. It's not free. IBM has a Fire server. Azure is open source. I've used that a lot. It's open source, but they have an hosted version on Azure. So you can pull the Docker image, play around it. It has some inbuilt authentication mechanism, which is pretty cool. I think for Fire, you still have to, use a third party to perform the authentication. I just gonna verify. So you can interact with it and figure this out. There are more, so just go out there, but these are the major ones. And for testing tools, you can test it to validate for testers among us. You can look at Inferno, Test Suite, Simplify.net. There are a lot of them. And for developers, there are some validations and testing we do. For instance, if you're building a Fire application and it's coming from the client side, even though you've structured your data and you want to post into your Fire server, you don't just post, right? You have to use some SDKs, which we have enough out there in Fire, in JavaScript as well, and some other programming languages. Just look for the one that fits what you're building. And you can use it to validate the resources, right? To be sure it's not compromised, it follows the standard. And there are different versions. So you have to know, okay, I'm implementing for R4 or R5, so it must conform with the version of Fire you support. Moving on. A sec. Okay. Yeah, that's that. So now we're gonna do the demo quickly. Sorry about that. Yeah. So how does it work? So like I mentioned, I'm gonna walk you through. Okay, before this, let me walk you through the HL7 Fire website. Now, if you go to hl7.org/fire, you're gonna get to this website. This is where this website is huge. You can keep diving and figuring things out and discovering things. This is the source of truth for the base standards for Fire, and this is the official website. So you can see it's on Redis 5, which is R5. I think that's the standard one for now. You can probably, when you Google it, please take note of the version you're looking at. You can see R4. Yeah, you can see different versions here. R4B, R4, R3. But this is like the official, the current published one right now. So let's quickly, if you browse through, you're going to find different levels. They describe it. Yeah, like I said, base document is XML, JSON, RDF, or whatever type. We have the level 2, which are the support implementation and binding. You can read through this, but I'm not going to draw too much on this. I'm going to go into the resource type to help you understand what we've actually discussed. Now, right here under the resource index, you can see it has been categorized by foundation, by base, by clinical, financial, and specialization. So if you're building a solution for, say, an HMO, just to track money and all those things, you're probably spending your time a lot on financial and figuring out which resource is best for, what I'm building. How do I map this? Discover, okay, this is the way we call it in our system. How do I map it back to Fire? That's what practically you're gonna spend your time, most of your time, figuring out. For instance, the base, some has been defined, like the patient, which, okay, it has a normative content type. We have the practitioner, which has a maturity level of 5. So I'm going to open the patient resource, for instance, just for us to look at how these data are. So if I scroll down a bit, I'm going to find the structure, right? And you can see it's telling you, okay, the name of this resource is actually a patient. And it just defines the information about an individual animal receiving healthcare services. So this is not just for human. If you're a vet or anything, this should confirm as well. So you have the identifier, which is the identifier for a particular patient, right? Active, is this person active? Whether the patient record is still active or not. You can see the type, and you can see the type here. This has to be Boolean. You have a name. This is how we connect the name. Patient, then down to name. And if you click on the name, so this is, a name is associated with a patient, right? Now, there's this cardinality, this thing called card. Let me just mention it out there. They are just things like, you can see it's a mapping. For instance, this status active, it says 0 to 1. I mean, it means, okay, you can only have one result. There are some that you're going to see, okay, it's 1 to 1. Okay, this must be present, right? When you're defining this must be present in anything you define. So when you're looking at some people's data, and for instance, it's, let's say I'm checking the address and the marital status, and it's missing, right? It's not a problem because even the standard says, okay, okay, it's not necessarily, you might not find it, you might find it, right? But if you find it, it's definitely going to be one. You can't have multiple marital statuses, right? But if it's this, you can say, oh, okay, address. You can have multiple addresses, but you might not find the address in this implementation guide. Meaning if I check the address and I find one address or multiple addresses, my system should be able to account for it, right? And for those, so that's the way things are. This is the way, how the resources are actually defined. And you can see it has to do with the patient. Everything here has to do with patient. Maybe the patient passed, then they can update the disease date time and all those things regarding its contact address, the relationship with the person. And you can check the binding. So it's so when you see, especially these codable concepts, there's a code tied to it, right? When you click on it, you can find the details of, okay, what's the coding, looks like. And you can see this is like this is a sample. This is a sample. SNOMED is telling you, okay, Acme result, the Acme lab result is negative. Okay, then the text. So you can find a structure of a coding system here, right? The format it takes. So you have to dive in and dive the part you get to the last resources. Meaning if I'm defining that, I have to show, okay, this is a codable concept. It has to take each of these value, and that's how I have to define it. So when I'm defining my system, I can't define technically an array has a Boolean or just you get what I mean. So like a number or an int, just an int variable. So moving on, I'm gonna show you. So speaking on, we spoke on implementation guide the other time, and I'm gonna click on implementation guide here. You can come to the implementation guide registry here. Those that have been submitted specification. Now you can see each, most countries they have your implementation guide, which is, you can see this is the US co-implementation guide, base US national implementation guide. So if anyone, for instance, if you're working for a client in the States, you can go and pick Nigerian implementation guide. Definitely you start with the base, right? This base that's been defined. You come here, okay, you look at it, you understand what to expect. Then you come back to the implementation guide and focus on US implementation guide because you're defining, specification for the US. They have come together and say, okay, this is the way we want to, define our own, what was it called? Our own healthcare data. Again, so if you scroll down, you can say, okay, for instance, let's look at one of the data, immunization, US core immunization profile. Okay, you can look at it and say, okay, this, and they're going to have a copy of their own. You can see this, right? If you look at the patient, it's going to be the same. But when you look at it closely, there are things specific to them, right? Probably, they have their own vaccines, the way they administer ZVX and all those things, which is specific to them. You can find it in their own implementation guide, but they're still going to follow the core anyway, the core of the implementation, which has been, designed. Okay, so moving on. Now let's quickly do the demo. I'm going to move to, so if you go to rp.fire.org and you go to base R4, whatever, I'm just viewing this Swagger file right now. This is like open to everyone. You can come here and interact with a simple FHIR server. And you can see what people have done. These are resources that has been created, and you can interact with everyone you can think of. You can come here and experiment with it. You can go to the FHIR server, look at examples. There are some examples you're going to find. Look at the examples, pull some JSON, build it, come here, come to the Swagger and just for devs, anyways, and just select the patient and or the resource you're interested in, and just interact with the APIs. And this can give you an idea of, okay, what is available to me? What can I do? And you can see right here. So for instance, I think, let's hope that record will still be there. I created a simple record like an hour before this demo. And this is the user data. I think the name is Musa Uche or something. And I'm going to try to, get it back using the get instance. Okay, I'm going to try it out. And I'm just going to dump the ID. So when I need to pull a patient, okay, yeah. So I get a response. And as you can see from my response, this is the patient ID. Resource type is patient. This is a div version of everything you have down here. Probably you want to do some mapping in XML and however you can use that. Identifier, you can see the identifier use, it's usual, the coding. This coding system, Mr. Let's go down, let's look at some important stuff. This is just someone's data I just put online, just manipulated the family name. Now you can see name. Okay, this user is active, which is true. Boolean, it can only be true or false. I can see the family name, the user is official, and you can see the given name is Bello Uche. This is just an instance. I didn't modify the rest just to for the sake of demo. Yeah, you can see the other data, right? The phone number and the rest right there. So this is how you can interact with it. Now, I've based my example on patients. You can do this for other results. I'm going to show you some other results based on when I get to the second demo. So that being said, let's move. So, and you can see this is the sample response you expect from it. Then for engineers, you can just map this back to your application, right? Meaning you're certain that every FHIR server you query gives you this, this definition of resource, and you're not worried much, even though you had your validations and all, you're not worried much about, okay, what's the format of the birth date? Okay, how's the gender gonna be written? You get that kind of thing. That's what FHIR, that's what FHIR define. Moving to the second demo, this is just products. We're trying to, not a product per se. I can call it just a vision we're trying to push out there. Courtesy of Softlyft Technologies. It's called Healthcare Africa, and it's just a digital immunization platform designed to strengthen vaccination. Vaccination is a big deal in Africa, and when you have the kids that are the future of tomorrow, and they are not well taken care of, they're not well vaccinated, then the future is not secured. So these, this idea is to take it upon ourselves to, track vaccination, strengthen the delivery, whatever has to do with vaccination, the frontline workers, the national healthcare system that are in charge of it, which is the primary healthcare in case of Nigeria, the healthcare facility, anything that has to do with vaccination, we want to make sure we strengthen it. And we're going to be building the system on top of FHIR, meaning the data, so FHIR system has compatibility with with FHIR, you can easily access the data. We're going to be open sourcing it. We're going to have a self-host version, which, healthcare can connect to, and, clinics can actually use for their day-to-day activities. We can have heat maps, dashboards to show us, okay, what is really going on in the vaccination world. But the mission primarily is to actually help us, have free healthcare vaccination for children between the age of 0 and 5, ensure that no child is left behind due to access to the vaccines, finances, or any data barrier. We're going to make sure, okay, we're starting this with Nigeria, and by hopefully we're going to scale it, and by God's grace across Africa, to make sure no African child is left behind over a period of time. And I'm going to show you, we put together something simple, an excerpt of the original one, which we're trying to push in the market. And I'm going to show you. So like I said, this is still rough. So if there's any glitch, don't mind me. I just had to quickly put this together, as a subset of the original one, just to make sure we have something we can demo. So think of it like this is where clinicians, nurses, whatsoever, anyone that is a staff of, that has access to healthcare record or has, the right to access this, can come and you log in into the system. And I'm going to quickly go through it. And we have some demo credentials right there. Mind you, we'll be deploying this so you can have a direct access to it and just play around. Okay, I'm gonna impute the password now. So I'm currently running a copy on my localhost, so there's no URL for this yet. Did I log in into that? Okay, maybe the server is asleep. Let me just refresh that page to be sure everything is working as expected. Okay, I think it slept off. That's interesting. So the idea is to have this platform track our patient record, immunization and the rest. And we have it mapped to FHIR. So this is an offline first solution. And for devs, the idea is to make sure, most African, rural areas, there's no internet and all. So it's an offline first solution. It's gonna just make sure, okay, we're using IndexedDB for the backend for the offline solution, and we're gonna use a React Next.js for the front end. And we have the FHIR server, we have a FHIR bridge, and some other solutions, which we'll have time to dive into. This is not a technical session, so I'm just gonna keep it short. Okay, hold on. Give me a sec. So I want to, why this is important is for you that are trying to piece the idea together, how does this work with real life? So this app could be an, EMR, HR, or whatever it is, right? It could be, any application you can think of, or it could be a mobile app, it could be an IoT device. And how does it connect back to the FHIR server? That's what I'm trying to show you here. So in this case, you could see I already created a patient with one vaccination record. I'm going to try to, let's see if this is going to respond correctly. Probably just add, I'm going to keep the patient I've created. I'm going to try to add another vaccination record to it. Or if not, if it's acting up, I'm just going to, show you how the mapping occurs in the system. Okay, okay, let me just show you the data. So we won't, I won't keep everybody here. It's basic, add patient, you come here, it gives you the name, which now once the form comes up, this maps directly to the patient record, right? Like I've shown you. So if I click on the view icon here, and this should actually open up the patient record, and you can see the immunization data I've actually added to it, right? And right there, you should be able to add more immunization record based on several encounters. Now, yeah, so this server is acting up right now. It's my localhost, probably, I don't know what's pulling it down. Pardon me for that. So you could see the patient record. And the idea of this is the contact person of the guardian or whatever. The idea is to make sure, okay, when the next upcoming vaccination is coming up, we can send you an email notification or WhatsApp or whatever, right? That's important for this. So now I've created one. You could add more, right? You could view the record. And I've added this icon for the sake of this, for the purpose of this demo, to view the mappings. Now you can see it's, there are some record I actually have added. And you can see when I click on this, FHIR, whatever. So what we did was I did a mapping of the system actually maps the record. So you're just gonna say form, the clinician filling it has no business with FHIR, right? The job of the clinician is just to fill the form. Okay, what's the name of the vaccine? You put it in, when's it gonna expire? What's the status? Who is the performer? And every other thing. Now the back end, what it does, it takes it and maps it back based on FHIR standard. As you can see, it recognizes, okay, this is my immunization, what's the status is completed, the code of the vaccine, okay, these are just random, they are standards, right? Okay, the code is called BCG. Okay, the display name, this is the display name. Then the patient, which patients, you can see a reference to the patients. These are references, right? This is the ID of the patients. For instance, if it's a real data like the one I created on FHIR, then this is going to be patient does this. When you take it, you can query the patient. Okay, what's the encounter? Encounter is just interactions when you come to the hospital. That's an encounter. Okay, this is the encounter that is recorded. Probably you might have several resources under a single encounter. Okay, this is the encounter, and the display of this encounter is, okay, immunization visit for this patient, occurrence dates, the performer who performed the Dr. Sarah. Okay, that's the name of the account I registered. You can see right there. It's a practitioner. This is a practitioner. Then we can have the mapping. Definitely, this is going to be the ID of Dr. Sarah in the system we already registered in the organization. Location, where is it performed? If you have multiple locations, if it's a single location, you can see the location right there. Which each of these is a reference which maps to another resource, which you can take, query, and get the resource. Okay, the lot number, the manufacturer of the product, the site coding, where did we shoot this thing is in the right arm, wherever the other one. Okay, we took one in the oral, the dosage, values, dosage quantity, value, and all those things, and the ID of the immunization, the date it was created, and the time it was updated. Now you can see this in action right now, right? How it actually works. I could add a sample, but I didn't have enough time to do that, to show the mapping of the patients I've actually treated. I'm going to share this with people once we deploy it, and you can play around, and probably have some other idea. You test it out, and you can see the mapping of like the encounter, because it has to map to encounter. So a single visit to the hospital is going to touch so many resources. The patient's details, encounters for this one is going to, immunization is going to touch vaccine is going to touch immunization. It's going to touch practitioner who administered it. It's going to touch organization, which the organization where you actually took the vaccine. Yeah, so that's the way we do the mapping. So when you define your user journey, you have to start figuring out, okay, which of these resources maps with what I'm trying to achieve, and that's why you're going to build it. Now, once you have this bundle, this is it that we can, and when we say bundle, you can build it into one if you want, or use whatever means then we post it into the FHIR server, and it's saved there. Then a third party can connect to that FHIR server. You're not going to connect to this. You're going to connect to the FHIR server and pull that record. They know the format already, and it works with them, right? And they can pull it into any devices. They can pull it into their watch, their smartwatches. They can pull it into their mobile apps, or whatever devices they want to use it into, a different web app and so on. So I think, in fact, I really don't want you guys to get lost. I hope this has been very helpful, and it gave you an introduction. These are important links which you're going to share as well. But once you just Google FHIR, I think you will have access to most of this. Just search the web. And I'm going to stop here. Thank you very much. I know I've taken most of your time. I hope this was insightful. And yes, one more thing before we move into question and answer. We're talking about implementation guide. I hope nobody asks that in the Q&A session. Yeah, there's this organization we've been working with, the HIN. I've been, been a part of them for 3 years. Right now, we're primarily working on the Nigeria fire implementation guide because Africa is way behind, and that's why we're having this kind of talk, right? Africa is way behind on this kind of things, and we're trying to say, okay, if you have to be the fire server now, which implementation guide are you going to use? You're probably going to pick probably the US implementation guide or stick to the standard one, which is safer. Okay, you stick to the standard one, you use it. Okay, we should have certain things for us, and these companies actually is an was is a kind of initiative you can be part of, and I hope everyone on this call can be part of this as well. And there's been a couple of connectathon that has been organized over the past 2 years. The third one is coming up in Abuja this year, next month, 26th of next month. We'll be sharing the details. I'll be there as well in person. And even the father, there's someone, Graham, is the father of fire. He's an Australian. He'll be coming to Nigeria as well. Hopefully, he's the one who started fire. So everything fire, I want to know. So we will be meeting him to even have discussions with him. So you want to be there if you can be there in person. If not, you can join remotely. So this implementation guide, we're going to share the link as well. Is what we're building on. It's still work in progress. Very, this was deployed a few months ago or weeks. So just to, yeah, you can see the date, right? The draft of 2025. So it's very, lean. And this is an opportunity for you. You want to grow your knowledge. We can come together, work on this, and we'll be working on each of the resources as well. So I'll be sending a link as well, or probably the organizer will be sending a link to those of us on this call to register for this event, and also join our group to start learning about it and making contributions. This is a big deal. This is probably in the nearest future, the government is going to adopt this and just take it. Okay, this is our implementation guide. This is the only one that exists in Nigeria presently. This is our implementation guide for Nigeria, and you being a part of it is a big deal. So I'm going to encourage you, to take on this opportunity and let's build it together. So I can't show you much yet, but yeah, it's small, but a lot of work has been done as well. As you can see, yeah, I think there are some samples. Let me check the file artifact. There are some samples here. You can see there's some hospital transactions bundle for HMO, immunization right there, care plan claims. Yeah, a lot has been done here. Let me see, is there anything for patient? Yeah, practitioner or patient. Um, So yeah, let's see that. Yeah, you can see. Aha, perfect. Yeah, you can see we have something for patient already. National ID, which is gonna be a NIN, I think in this case. Medical record number, um, birth certificate. There are some things, yeah, that's here. You can see, yeah, provider. You can see now when you're looking at this, you understand it. Like, okay, this is the provider. For example, MTN, that's the line the person is using. The code is gonna be MTN or whatsoever, right? Then you put the now you can see this is like our own thing. We understand it. Yeah, you can see the national ID. You can see the NIN number of the client, which is a unique 11-digit code. So anybody implementing something in Nigeria that is using the implementation guide can't go wrong. They don't have to worry like, should I go and generate one in my database and just use random strings? No. It's the NIN of the person. And the NIN, everybody in Nigeria now, if you're mature enough, you have NIN. So you can see why this is important. So we know that all the systems can easily be connected. I know when I'm connected to your system, it's actually the NIN I'm using. So that's just a brief, it's important I discuss this. They are big, in fact, they've pushed this discussion as well. Yeah, they're doing awesome things, and I would like you guys as well on this call to be part of us to move things forward. So I'm going to stop there right now because I don't want to take us beyond on her. So question, I'm going to take question now. Bumi, thank you, and over to you. Yeah. Okay, Bumi, are you there?
Yeah, we have some questions in the chat. Let me just read it out. The first one is we have from Yomi. The front server and the back end server, are they the same?
Okay. The FHIR server and the backend server, are they the same? Oh, okay. So how do I? So the way I'm going to answer that is it can be a yes or no answer, right? For instance, if I'm building an application to just save the FHIR resource, and just give it to a third party. If that's my application, then I can, you see the way I've bundled this application into a JSON, I can post it directly into my FHIR server, which is technically a backend server, right? It's not a client side, it's a backend server, right? Sitting somewhere, your cloud or whatever, where you have it, right? So that is one. So it's like it's a backend server on its own. But in terms of implementation, we always have like the app backend server itself that handles the application logic. For instance, if you are building an application, you can't use just the FHIR server as your backend server, right? Because there are some other things. If I want to have, so I have to create a different, there are some application logic that has nothing to do with FHIR, right? Like if I want to have display my dashboard and all those things, I want those record to be in my backend server, depending on architecture. And at times, if you want to do some analytics and all those things, you want to query, we duplicate the data. We have some data properly structured for application use in our backend. So I could have a FHIR server with a FHIR bridge which maps the FHIR server, validates it, and saves the record. And at the same time, I could have a solution which this front end is feeding, or use the FHIR bridge itself or the middleware to actually feed my my application server as well, which can be two different servers at the back. Depending on your services, it can be several microservices, and one of them is just your FHIR server, but it's actually a backend service, and you can have multiple ones. And if you decide to use it as the primary source, if your use case allows it, then fine.
So the second question is the FHIR server a global server we have to sync our data to?
No, you have to have your own copy. You have to have your own copy of your FHIR server, right? Meaning, if, for instance, what we're building now for Healthcare Africa, I will have a copy of our own FHIR server. Thank God they are open source. You don't have to build it. You can leverage the open source one. Microsoft has an open source one. API is a big one. You could take it, and if you don't want to go through when you're doing open source, you have to have the technical know-how. If you think, okay, I don't want to go through that, then go to Google FHIR Health. It's a managed service on Google Clouds. You're gonna find it there. Azure has too. You'll find it there. Almost all cloud services has, right? It's a managed service. You just plug in and just connect your application to it, and you save it. Now, when someone wants to come and get that data, definitely with consent. Healthcare data are very sensitive. Then you build your application to have support for the authentication I mentioned, or authentication. Or if you want to do authentication, go and read Smart on FHIR. It's very important to understand Smart on FHIR if you want to do application. Meaning my application will authorize my FHIR server as a standard. Okay, if you're coming from here, the user has granted consent, then we're going to authorize our FHIR server to give you the record. Then you query the record. Then you go and save it in your own FHIR server, right? Or you can use it directly. If we established the connection, we can use it directly.
Now, still cooking the call. I just finished the
I'm getting feedback.
Yeah, okay. Thanks for that, Olumide. I think you already answered this third question. So the third question was asking if it was actually legal to get people's data from the FHIR server.
No, it's the FHIR server is closed. It's like you can't access it. It's authorization. So if you don't have access to it, you can't access it. So there must be consent. There's something I once built a consent-based application, meaning a mobile app, I have to grant consent to the organization to access my data, right? So there's it's not open. But okay, the API you're looking at, these are just test records. Please don't put real solutions in the API FHIR server. It's just for testing, right? You're gonna have your own personal, your company's gonna have their own, which is locked. And they're gonna only provide access for their partners, which they're partnering with, right? So, and define their own standard. Yeah, thank you.
So we have some people with questions. Can you go on with your question? Onyeka. If you're talking, you're on mute, Onyeka.
Oh, sorry. I was actually going to ask about something, but this person had actually asked it before, and he answered it partly. But let me just rephrase it. My question is, does FHIR, like, is it a central database, like a central, data architecture where everybody in the world or every country in the world who has decided to adopt FHIR will just like upload their information there? Or does each country have their own data architecture that they put it only using set and FHIR guidelines?
Oh, okay. No, okay, let me answer it this way. No, FHIR is not a central database. FHIR is just a specification. Let's clarify that. Let's differentiate between what FHIR is and the FHIR server is. The FHIR definition, it's just a definition of resources. So when I say FHIR, I'm not talking about, the technicality of implementation or a server or anything. This is what I'm talking about. I'm talking about this definition. You understand? It's saying it's the concept of a patient. If you need to integrate a patient into your system, how do you define the data of the patient? If you need to implement immunization, what guideline should you follow to implement it? That is FHIR on its own, right? Now, the FHIR server is now the tool, a server that has been built to actually conform with these guidelines, right? You get what I'm saying? So meaning, if I am building my solution, like I said, if Federal Medical Center is building their solution, they're going to have their own central FHIR server, which they're like their own personal, data repository, which they're going to map it and save the entire data into it. I am building Healthcare Africa now. I have my own FHIR server, which I am saving my FHIR resource, right? Now, if I need a patient, or I have a patient that says, okay, I want to move into Healthcare Africa, immunization record, but we've been working with FMC, right? We've been, the Federal Medical Center, that's where our vaccination has always been and other things. Then the question now becomes, okay, how do I pull your record? Then I have to authorize my application to connect with FMC FHIR server using the whole standard, smart on FHIR, whatever we've defined, and FMC allows, it's standard anyway, to retrieve the data of that patient and bring it into our, you get what I'm saying? So that's the way it works. So on its own, FHIR on its own, it's not a server. It's not a data repository. It's a standard.
Okay, thank you very much. Yes, it does answer my question. Thank you very much. And one last thing I just wanted to ask is, I am not like I don't have a FHIR certification, but if I were to like get a FHIR certification, how would you advise me to go about it? I am a pharmacist. I am a data scientist. I have some knowledge of data engineering too. So this FHIR, it looks like a data engineering guideline kind of. Am I wrong? So if I was
it's about data. It's about healthcare data. Yeah.
So if I were to start a career learning FHIR implementation, how do I go about it?
Okay. Yeah. So there is actually a certification route. Just like AWS and the rest, they have their certification route, Google and all. HL7 has a certification route for FHIR. So I'm going to encourage you to visit HL7 website. I look at their certification. They have several levels of certification as well, which is going to make you once you have the certification, it's going to make you an authority in FHIR as well. But beyond the certification, I think it's important, you thank God you're in the space already. You be a part of the community and also learn, the core part of it, right? Okay, get your hands dirty as well. And that's going to help you know how this thing works in real life.
All right. Thanks, Olumide. Before I go into the other question, a link was dropped here. So Olumide talks about the connectathon that is coming up. So a link was dropped here to 5 connectathon, the DHIN connectathon on Zulip. And this is a link for you to be able to join the immunization track that is being led by Oduola. So the link is from the chat. So, we have some people with questions here. Joe, can you go on with your question?
Kobe, I think we're getting feedback. Can you please? Okay, thank you.
Yeah, so Joe, can you go on with your question? Your hand is up.
Okay, yeah. Good afternoon. Thank you, Olumide, for that awesome presentation and insight. Yeah, my name is Joseph Adagba. I'm a QA engineer. So I want to ask. Actually, I have a couple of questions, but I'll be asking one for the sake of our time. So the question is on your first presentation. So I want to ask, what is the difference between resources and profile? It sounds and look the same. So if you can share more light on that, thank you.
Okay, thank you. So I'm gonna scroll up back to the core concept. Okay, so yeah, so here's it. Now we discussed here that resource is the building block of FHIR. Like the patient we looked at now, that's a resource patient. If you come here and look at this, you can see resource. You can see this resource is called a patient. That's a resource. Now it becomes a profile when it is implemented with an implementation guide, right? So don't get confused. It's technically the same thing, but we have taken a version of it. Okay, let me look at. I'm looking at this, the standard, right? I'm looking at the patient resource here, based on the standard definition that we all gonna adopt, right? Now the second tab I have here is the US core definition. This I'm looking at the US core implementation guide. Now, when they have their own version of the patient, okay, I'm looking at the immunization now. Now, this is what is called the profile. Meaning, once a resource is adopted, rather, it becomes a profile. Do you understand? So when I use the term, let's check the patient resource. I'm technically, referring to the standard. Okay, let's go and look at what is there. Then when I say, okay, let's look at the patient profile for the US core implementation, we are looking at a version of the resource that has been adopted by an implementation guide for a particular country. I hope that's clear.
Thanks.
Yes, thank you.
Okay, we have another question here. Layo, can you go on with your question?
Thank you. Please, I would like to understand, I need a little clarity on something. When we browse through the resource category of the FHIR website, some resources are labeled 1 to 5, while some are labeled N. I would like to understand the difference, why some are 1 to 5 and some are labeled N. Thank you.
Okay. So I think that should be in the resource type. Let me see if I can navigate back to it. Okay, those while it loads, those are just maturity levels. So let's clarify that. Those are just, yeah, you can see, okay, yeah. Even you can see here, this says maturity level is N. Those are just maturity levels. So it starts from, I think, 0. Then it runs through to N. Yeah, I believe this is what you're referring to, each of this category. Yeah. So when you see the letter N, it means the resource it's mature enough, right? It means it's really mature that it's not going to change at any time. Meaning, okay, so you're gonna find it in some of the resources, capability statement, and even patient. I think patient has, yes. It means it's mature enough, like, okay, we've grown this resource from level 0 Then it has gone through level 1, 2, 3, 4, 5. And nothing has really changed, for a while. And I think they think, okay, we've covered most of the thing we need for this. Then they make it a normative content. Meaning, okay, it's stable. You don't have to worry about this. So when you're dealing with a resource that has a maturity level of N, meaning you don't have to worry about it. Do what you need to do with it. It has no problem. But when you're dealing with a maturity level of, say, 1, okay, it's still in its early stage and things can change. Breaking changes can happen in the structure which FHIR is defining. And that's the difference. So think of 0 as, the lowest stage of maturity. And we're going to transform it down to 5, which is the highest stage of maturity. And N is like, okay, we're good. Let's transition you into a state where, we're certain we've achieved a lot with you. That's the difference.
Thanks, Olumide, for that. I think that's all the questions that we got for today. I don't know if you have any final thing you'd like to say to everyone before we end this session for today.
Okay. Like I said, my closing remark is FHIR, it's big, it's huge. There are opportunities, a lot of opportunities in this space. And I would like everyone in this group to be a part of it. Dear China is a good one. We can we can join and keep moving. And definitely you can reach out to Softlyft, the organizer of this, to help you get through the process. And the link shared is a link to the connectathon that will be happening. Like I said, I'll be leading the immunization track. I need people I can work with, and we'll be working on the implementation guide as well. Please join. And the other tracks, probably what you're working on has nothing to do with immunization, and you're not excited about it. It's fine. We have about 5 other tracks which you can join, you can learn. We have claims. If you're working with, HMO, you are in that space. Then claim is a good one you want to start looking at, right? Because at the end of the day, the integrations will happen across healthcare system and even insurance companies. So I encourage you, keep learning, keep reaching out with questions, and we're gonna get there with time. Thank you.
Thanks, Olumide. Thanks everyone for joining this session today. So this session is recorded and we'll be posting it on our YouTube channel. So thanks everyone. And the link is on the chat. Please, you can click the link to join the immunization track that is led by Olumide.